For more than a century, infections have been known as a major cause of lower fertility or infertility in horses. One of the most frequent causes of infection is Streptococci. Although Streptococci are usually easy to diagnose and treat, we have recently discovered that they can form a type of latent infection. The latent infection is usually buried deep down in the endometrial tissue and caused by metabolically inactive or dormant bacteria. The dormant bacteria pose a particular challenge because they're very difficult to diagnose and also very difficult to treat with antibiotics. The dormant bacteria pose a particular challenge because they don't grow. And this is a challenge because all diagnostics are basically based on growth-dependent methods. So when you take out a traditional swab, a biopsy, or you make a flush of the uterus, you won't see growth of the bacteria if they're in the dormant state. We have actually invented a new resuscitation medium, which is going to be infused into the uterus. And the beauty of that is that it can reactivate dormant bacteria, so they start growing again. You simply get them out of this dormant state. And then you can use the same diagnostic methods as you've used before, and then you can see a positive result. So in essence, the growth medium is actually inducing an endometritis that is based on resident bacteria that you were not able to see before. Besides difficulties in diagnostics, the dormant bacteria also pose a very big challenge when it comes to treatment. The reason for this is that the inactive bacteria don't respond on antibiotics because most antibiotics only work on actively dividing cells. The dormant bacteria are completely inactive, so there's not really anything to inhibit. We've actually tried to expose dormant streptococci to very high levels of penicillin, up to 30,000 times Mik, and they still tolerated and survived this kind of treatment. You can imagine that this is a very big challenge in the horse where you cannot reach levels and also you would not treat for a long time. So the dormant streptococci cannot be cleared unless they are getting back into an active mode. Consequently, reactivation of dormant bacteria is not only important for diagnostics, but also for effective treatment. To investigate how dormant bacteria affect fertility, we looked at 19 problem mares, so mares that have experienced endometritis, abortions, or having had difficulties in getting in foal. In all 19 mares, we infused the bacterial growth medium Bactivate into the uterus. After 2 days, 16 mares tested positive for Streptococci. These were cleared with antibiotics and later went into breeding with fertile stallions. All 16 mares got bred to fertile stallions. 15 got pregnant and 15 gave birth to a live foal the following year. So it seems that the latent infection substantially lowers the fertility of the mares and that the clearing of the infection can substantially increase the fertility of the mares. So if you want to help your problem mare getting pregnant, you should consider using Bactivate.